For many women, a heart attack can be a sneak attack that even your doctor couldn't predict. Find out about new hidden risk factors and tests that could save your life.
Unfortunately, coronary microvascular dysfunction cannot always be detected on the initial evaluation of a woman with chest pain. For example, a regular treadmill exercise test, while it gives us a lot of information about a woman's exercise capacity and ability to increase their blood flow to the heart, sometimes cannot diagnose microvascular dysfunction. We know that certain tests are originally intended to diagnose heart disease with blocked arteries, which is more common in men than in women. And because women's hearts are different, that they tend to have this dysfunction of the small vessels, we now have other non-invasive imaging tests, including cardiac MRI, as well as cardiac PET scan, to evaluate the function of these small vessels. Because we are still working on improving the ability of these non-invasive tests to diagnose microvascular ischemia, sometimes we do have to recommend a woman to have an invasive coronary angiogram as a more gold standard evaluation, a more ultimate diagnosis of microvascular dysfunction and how to target therapy to treat their chest pain. I recommend women to not take no for an answer until they've gotten a good explanation of what their chest pain can be from. It's very common for women who have persistent chest discomfort, but who have apparently normal-looking coronary angiograms, to be told that they're completely fine and that some of their symptoms may be just due to anxiety or stress. But we now have learned that this condition called coronary microvascular dysfunction can actually be the reason why they're having chest discomfort, that it's not just due to their, it's not in their head. It's not something that they're making up. It is known that a lot of doctors, especially primary care physicians, are not well equipped to address a woman's cardiovascular risk. In fact, we know from a recent survey that over 50% of doctors don't feel comfortable in addressing a woman's cardiovascular risk in their office. So we do recommend women to be a champion for their own heart, to really understand what their risk factors are, both the traditional risk factors as well as these more non-traditional risk factors, such as their pregnancy history, whether they have inflammatory conditions, or even if they have a family history of heart disease. That's very important to be aware and to really stress that to the physician that's taking care of them. It is important that women feel that they are truly being listened to by their physician. It is an interaction between the patient and the physician that allows a successful diagnosis and management and further relationship to prevent heart disease throughout the woman's life. And so if a woman feels that they are not getting the appropriate attention to her symptoms, we do recommend for her to seek another physician who will.